Hello everyone, this is Dr. Ghazal Matloob Baloch and welcome to my 8 days course where we will be discussing top 80 high yield stations, and this is the day 1, this is the session 1, and today we will be discussing 10 stations. We will discuss 10 stations each day, and the day 1 we are going to discuss 10 stations but not well 10 stations. Chest pain have got 4 to 5 scenarios, tiredness have got 3 to 4 scenarios, so it will be around 17 to 18 stations that we will cover today. We will start with the chest pain, and then we will do tiredness, and then we have polymyalgia rheumatica, and number 4 is multiple sclerosis station. Then we have post-herpetic neuralgia, and then transient ischemic attack, and then is the acute gastroenteritis, and then UTI with the confusion, and multiple myeloma, and in the last we will do trigeminal neuralgia. I will try to cover each and every aspect of these stations because the stations we are going to discuss in this 8 days course will have all those high yield that have come in exam multiple times, and you have to ace these stations in a very good manner so that you know that if this station is coming because it's high yield, you are going to score around 9 to 10 at least out of 12. And I will tell you that how can you do that, and how to make a right diagnosis. It is really important. uh, I will discuss the structure and the approach toward every station. It will be different. There will be a set of questions related to that station, and you have to memorize and remember those set of questions because I don't want you to mess these 80 stations. And these 80 stations, if you have full command on them, at least 5 to 6 stations will be from these 80. And it matters a lot if you're at least 6 to 7 stations or 5 to 6 stations are coming from here. And I hope that then you can ace this exam easily because you need only 10 stations to pass the exam. Okay, starting with the chest pain. So chest pain is not a station, it's a symptom, and according to the symptom there could be multiple scenarios that will be related to chest pain. Now you have to pick the right diagnosis for the chest pain because it's a very common symptom, it's a very common station, and I don't want you to mess up this station, particularly stating the wrong diagnosis, because it will have a very bad impact that your clinical is not really good and you were not able to pick the symptom. So coming with the chest pain, there are a few things that will be universal in every session, and that is GII. What is GII? G is for the greet, I is for the identify, and then I is for introduce yourself. So every station you will do the greet, identification, and introduction before starting the station. And that means that you will greet the patient by saying hello, good morning, or hello, good afternoon, according to the time slot you are giving your exam. And then after that, you will identify the patient, like, after introducing yourself. Uh, you will say that, I am Dr. Ghazal Matloob. I'm one of the doctors working here in this medicine department, let's say, for example. And can you please confirm your name and age? Or you can say, I can see from my notes that your name is Joshua. Is that right? Can you tell me your complete name and your age? So now you have done the greet, you have done your introduction, and you have introduced yourself. So after that, doing this GII, now the scenario is about the pain. I will send you the link where I have discussed, how to do the history part, and if this symptom is present, then how to move on with that, and if this symptom is present, then how to take the history of presenting illness in a detailed manner. So, for the introduction, if the scenario is about the pain, you will do Socrates, and if the scenario is apart from the pain, then you will do Odipara. What is Socrates? Socrates is about the site where the pain is, onset when it started, consistency means the nature of the pain, and R is for relieving any relieving factor, and A is for if there is any aggravating factor for the pain, and T is if this pain is transmitting or going anywhere else, and S is for the score, if you can score your pain on the scale of 1 to 10, 1 being the least and 10 being the maximum pain for you. So, if the scenario is about the pain, then always you will do Socrates. You have to ask every question. Now, I'm going to say which questions. If this is the pain, you will say, okay, can you tell me where it is? How did it started? When did it started? And can you describe the nature of pain for me? Is there anything that makes your pain better for you? Is there anything that is making your pain worse for you? Is it this pain going anywhere else, or is it only in this region? And if you have to score your pain on the scale of 1 to 10, 1 being the least and 10 being the maximum, can you score your pain for me? These questions should be on your fingertips, and don't mess up with the Socrates. Ask every question. The best way to start with a station is to have a golden 1 minute. And what is that golden 1 minute? That means that any station, you will go and you will ask the query from the patient after doing GII, that what brought you to the hospital today? And patient will tell you the one presenting complaint that the patient will be having. Now, the best way is, rather than asking any open or closed questions, you should say, can you tell me more about it? Now, this is a very open question rather than the closed question. Now, it will give freedom to your patient to speak about the presenting complaint. So, when the patient says that I have a chest pain, doctor, that's why I'm here today. Now, rather than saying that, can you tell me where it is and all, before starting it, you will give that one golden minute to the patient and you will say, okay, Mrs. XYZ, can you tell me more about it? If the patient want to spit out the information, the patient will do that. But if the patient say like, what you want to know, doctor, then you will start with the Socrates. Now, I hope that I'm making the point. If patient spits the information like, doctor, I have this pain started 2 hours ago and it's on my left side, now you know that the patient have tell you the site and onset. Now you will not repeat those questions and you will start with the nature of the pain now, consistency of the pain now, rather than starting all over. Don't repeat the questions, actively listen to the patient. But if the patient say that like, what you want to know, doctor, then you will do the Socrates. Okay, well, can you tell me where it is, when did it started, like this. Okay, and at one time ask only one question. Do not ask compound questions. Do not ask two questions at a time in hurry, because it creates very bad or negative impact. Being a doctor, if you are in hurry and you want to cover all the questions like in one go, because patient will not give you the proper information then. Okay, after doing the Socrates, now coming to the associated symptoms. Okay, so associated symptoms with the chest pain, that should always be asked, because if you don't ask these questions, then that means that you're not ruling out all the red flags related to your chest pain, or you will not be able to make a diagnosis. These are the questions that will rule out your differential diagnosis for you. So first, you will ask, after doing the Socrates, you will again give freedom to your patient and you will say, is there anything else you want to tell me, Mrs. XYZ? And patient will say, like, what, doctor? And then you will start with this set of symptoms. And you will say, can you tell me, like, do you have shortness of breath? And patient will say yes or no. And then, do you have fever or flu-like symptoms? Do you have any rash anywhere on your body? And number 4, do you have any vomiting or do you feel sick? And do you feel like your heart is racing? Don't ask for the palpitations directly because a patient won't understand. You will say that, do you feel that your heart is racing? And then in the last, you will ask about any trauma. So trauma, like you will say, did you hurt yourself recently? Now, why we are asking all these questions? All these questions should make sense to you, and only then you will be able to remember these questions, because you are asking shortness of breath because you want to rule out heart condition. In acute coronary syndrome or MI or angina, there could be shortness of breath. You are asking fever because it could be pericarditis, and pericarditis can present with fever. You are asking rash because it could be herpes zoster infection. There would be a rash on the chest. You are asking about the vomiting, again associated with MI. Patient can feel sick. You will ask if your heart is racing because palpitations are common with heart attack. You will ask about the trauma because you want to rule out costochondritis. Okay, so now every symptom is making sense to us. We are not asking any questions without making sense to us, because it's silly that we are asking illogical questions, or we are asking the questions without even thinking that what could be the benefit by asking this question. Now remember these questions by thinking about the differential diagnosis in your mind that comes with the chest pain. Okay, after that you will do maftosa. Now what is maftosa? This is session 1, day 1. That's why I will be talking in detail about the history. After that, I hope that we will be clear about Oedipara, Socrates and maftosa, and I won't be repeating again and again. Okay, now maftosa, M is for, I have written it in the bracket, you can see that. So M is for the medications. You will ask the patient that if the patient is taking any kind of medications in the past or any OTC supplements, like any herbal products and all. A is, you will ask about allergies. Do you have any drug allergy? Do you have any food allergy? F is for the family history. Now in this chest pain scenario, what family history could be important for you? Family history of heart diseases. Okay, you will be particular about that. Okay, that do you have any family history related to any heart disease? And then what is your occupation, like do you work, and what kind of work do you do, or what kind of job you have? T is travel. Did you travel recently? Now why travel history is important in chest pain? Because you are trying to rule out pulmonary embolism as well. Chest pain is also related to pulmonary embolism, and long flights with sitting and like no mobility can lead to pulmonary embolism. You will ask about social history, like do you, with whom do you live with, and do you have anyone who can take care of you while you are in the hospital? This kind of questions. And last A is for anything else, like do you want to tell anything else before finishing your history and moving on to the next part, doing your examination. You will always ask the patient, is there anything else that you want to tell me, Mrs. XYZ? Okay, so like that. And with that, I will add with the social history your personal habits. Always ask about, do you smoke and do you drink alcohol? These two questions you won't miss in any history question, in any history station, in any psychiatry station, in any gynae station. So smoking and alcohol should be on your fingertips, that you will be always asking. Family history you will always be asking. Medication history and allergies you will always be asking. So maftosa is important. You can skip occupation, you can skip traveling in few cases. You will see the case and you will decide accordingly, and I will be telling you. In this case, occupation is important, traveling is important, so you won't miss anything in maftosa. Okay, so after doing maftosa, after asking associated symptoms, doing Socrates, now coming to the apply the ice. Now before you move on to the part where you will say that I would like to do your examination and all, you need to explore the idea. You need to know that if the patient is having something, like if patient is having any idea or not.